Wassalamu ala Rasulillah. So we have a very important and new news and very good news in Ruqya that we are going to share with you inshallah. This is Dr. Ihab Sulaiman.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Ihab Sulaiman. I'm a specialist in psychiatry and neurology. I've been practicing in Africa alone for the last 5 years or so. And I'm gonna explain briefly how I got to know Sheikh bin Halima. Well, like a lot of people and a lot of doctors, we are scientifically based, meaning we see something, we believe something. We don't see something, we don't believe. So just like any other doctors, this is how we were trained. Scientific-based medicine, meaning evidence-based medicine. I see an evidence, I believe it. I don't see evidence, I don't believe it. This is how we were trained. So I don't blame anybody for not knowing. Well, I was one of them till about 1.5 years ago when my daughter, 12 years old, gets sick. That is, my daughter gets sick. And how she gets sick? She was trembling. She fall out. You know, she cannot breathe. Her legs are, this is how it started. I take her to the clinic. You know, I have 2 clinics, one in the southwest and one in the north. I take her to the clinic. I put oxygen. I measure the vitals. Everything is normal. I run all investigation. Everything is normal. Yet, a couple of days later, she followed the same thing. 3 months, 4 months down the line, the girl started to tremor very bad, as if she had epilepsy. But now we know epilepsy comes in 2 flavors, either psychogenic epilepsy or true epilepsy. Now, I did the EEG, I did the MRI, I did the CT scan, normal. I did LP puncture, normal. I did all electrolytes, normal. Everything I have done turned out to be normal. Listen to this. One night, the 26th of November, last year, that's 2018, right? 26th of November. I cannot forget this date. At about 3 o'clock in the afternoon, my daughter started to tremor, and the tremor will not stop. I made video, I sent it to a specialist, okay, in Ohio, somebody who's specialized in epilepsy for the last 25 years. He said it's epilepsy and take your daughter to a hospital because this is a status epilepticus. You know what status epilepticus is? More than 10 minutes, the girl is dead. So I panicked, and then he recommended that, you know, I also know that I put the girl in induced coma. I induced coma to a girl, meaning phenobarb IV, not more than 1,000 milligram in 24 hours. And that's what I did. Every couple of hours, I inject her with 100 milligram of phenobarb. Every couple of hours, she wakes up, I inject her. I put her in coma. I induced coma in the little girl, and I took her with the ambulance to a center or a hospital, since I was far away, that has respiratory ventilation. So I can put her in a ventilator, so a ventilator can breathe for her. So you can imagine how much I panicked and how much I was traumatized. And guess what? We put her in all kind of medication. Whatever you can imagine for epilepsy, we put her. Valproic acid, we put. Kebra, we put. Whatever you can imagine that works for the situation, we put. Even antipsychotic medication, risperidone, 4 milligrams, we put. Everything you can imagine, we put. Guess what? After all that, she still gets the tremors at night. I'm talking about tremor that lasts for 15 minutes. Now, somebody said, you know, why don't you think spiritual? I said, what is spiritual? I don't believe in it. Even though it's in the Quran, I believe it's in the Quran, but I do not believe the significance and the magnitude and the impact of sihr or black magic or jinn can be that much. I didn't believe so. So we seek the help of spiritual healers. You know, she recovers small. Then I did my own investigation online to look what could that be beside medicine, because medicine is not working. So I came across Sheikh bin Halima's site, and I thank God that I came across his site and I learned it, I studied it, I seen his videos, I studied his method, and I applied his method on my own daughter. And guess what? Alhamdulillah, she's healed. And now, after almost a year from that incident, or exactly a year from that incident, Sheikh bin Halima is with us in Cameroon, and I really appreciate what he have done for Muslims and for the Raqiyah. And I recommend every physician study. If nothing works for your patient, no investigation come out normal, think about the spiritual. I know you haven't studied it in school. I know you weren't trained for it. But believe me, from my own experience, everything I have done and I have seen is documented by video. I have patients that I applied the same method for. It works. Some works Ruqiyah alone, some works medication and Ruqiyah to treat the after effect of a black magic and jinn. It's a fact. It will remain a fact. If you ignore it, you are ignorant. Please consider it, study about it, and you will see it will work for you and your patients. Thank you very much.
Jazakallah khair, Dr. Ihab. So the new fact we have in Ruqya now is that we have 2 clinics, 2 hospitals, that have general medicine plus specialization in psychiatry that have introduced Ruqya work inside these clinics. So the doctor himself learned Ruqya, but he's also got a Ruqya team and catchers and everything and hijama and Ruqya products in his clinics. And this is the good news, because we were running after that for years and years to convince doctors, to convince hospitals that a few numbers of illnesses are spiritually induced, are due to jinn and magic, and this is the first time we have succeeded by the will of Allah Ta'ala in introducing Ruqya in clinics and hospitals. And so this is the good news. May Allah Ta'ala cure our patients and guide us and use us for the good of Islam and Muslims and everybody. Wassalamu